بسم الله الرحمن الرحيم. نكمل محاضرتنا على النيك إلى deep structure of the neck. حقيقة deep structure of the neck multi-vesicle of the structure within the neck. نبدأ with the thyroid gland. The thyroid gland is an endocrine gland that produces thyroxine and thyrocartilage, which are essential for metabolism and growth. T3 and T4 is very important in the growth of any person. The thyroid gland is located in the anterior neck, spanning between the cervical 5 and thoracic 1 vertebrae. إذا location of the thyroid gland هي تكون بالneck ما بين ال 5 cervical vertebrae to the first thoracic vertebrae. That is the its location and anterior to the trachea. In the male, that is located anterior to the trachea, but in animal, that is located posterior to the trachea. So it is very important in breathing of any person because location of the thyroid gland anterior to the trachea. The thyroid gland seen from the front is H or U shape, consisting of right and left loops connected by isthmus, which usually cross the second and third or second, third, and fourth tracheal ring, and in constant pyramidal loop extend upward from the isthmus, usually to the left of the midline, and may be anchored to the hyoid bone by a fibrous or muscular band known as the levatory gland thyroidea. إذن تتركب من two loop هي anterior to the trachea ما بين the second, third, fourth trachea ring راح يكون right and left loop. ترتبط بالإسمس. فوق الإسمس أكو other loop loop. هذا حقيقة هو extension ويصير يرتبط بالهايد bone by the membrane or muscle. The gland is covered by an adherent fibrous capsule and sheet false capsule derived from the deep cervical fascia. حقيقة متكونة من two fascia من capsule يسموه fibrous capsule و deep fascia that surrounding the thyroid gland. It lies behind the sternothyroid muscle, forming around the Carotid Cartilage and superior tracheal ring. It's inferior to the thyroid cartilage of the larynx. The gland is a vesical component of the neck, along with the trachea, esophagus, and pharynx. The compartment is bound by pretracheal fascia. حقيقة هي من ضمن pretracheal fascia اللي تحيط الاسophagus and trachea and the pharynx and all that surrounding in the neck. The blood supply of thyroid gland. The thyroid gland is highly vascular and is supplied mainly by the superior thyroid artery from external carotid artery and the inferior thyroid artery from the cervical trunk of subclavian artery. The thyroid artery is a constant branch of variable organ, example from the brachiocephalic trunk that ascends the isthmus. This is the arterial blood supply متكونة من superior and inferior thyroid artery و thyroid ema. The venous drainage. The thyroid gland is drained by superior and middle thyroid vein into the internal jugular vein and the inferior thyroid vein into the brachiocephalic vein. Again, three veins that drain the blood supply of the thyroid gland, the superior and middle and inferior thyroid vein. Lymphatic drainage. The lymph vessel drain first upward to the deep cervical node and second downward to the pretracheal node. The isthmus drain into the prelaryngeal and pretracheal nodes. That is the lymphatic drainage of the thyroid gland. Are endocrine glands that play a vital role in the regulation of calcium and phosphorus metabolism called parathyroid gland. This parathyroid gland or a gland or two pairs of glands that are located in the posterior surface of thyroid gland. Usually consists of 4 or 2 to 6 small ovoid bodies that lie against the dorsum of the thyroid under its sheath but with their uncapsulated. Are supplied chiefly by inferior thyroid artery. Its blood supply through the inferior thyroid artery alone to the 4 or 6 small. Now, the thyroid cartilage is a hyaline cartilage that forms a larynx prominence known as the Adam apple, which particularly appear in males, as a superior horn that is joined to the tip of the greater horn of the hyoid bone by lateral thyroid ligament, and the inferior horn that articulates with the cricoid cartilage. Then, it is one of the laryngeal cartilage and prominent like Adam apple in male, where we had two horns superiorly and two horns inferiorly, the greater horn and lesser horn. Little but we have the greater horn of the hyoid bone and with the cricoid cartilage. Now the trachea. The trachea, which is a incomplete ring of hyaline cartilage, lies partly in the neck and partly in the thorax. The trachea extends from level of T6 vertebrae to about T6 to T7. The cervical part is related in front of infrahyoid muscle. The thyroid isthmus generally over ring 2 to 4. The vessel, example, inferior thyroid vessel that pass through the trachea. In the trachea tibia cricoid cartilage, the first ring as a complete ring in the cervical area and go to the thorax and divide it to two bronchioles. This is the consent of trachea. Beneath the trachea, we have esophagus. The esophagus lies in the neck, thorax, and abdomen. The esophagus extends from the C6 vertebrae to about T11. That is narrow point and adjacent to the inferior constrictor of pharynx, about 15 centimeters from upper incisor teeth. Is location here cone below the upper incisor teeth, about 15 centimeters. It extends in the neck and in the chest and in the abdomen to the stomach. The cricopharyngeal fiber of inferior constrictor have a sphincter-like effect. The upper part of esophagus consists of skeletal muscle that is attached to the lamina of cricoid cartilage. The esophagus is posterior to the trachea and anterior to the longus colli and vertebral column. إذا الأسوفيجاس هو ما بين التراكية and larynx and the vertebral column. Now we go to the carotid arteries. The main vessel of head and neck are right and left common carotid arteries, each of which divided in the carotid triangle into external carotid artery, which supply the structure external to the skull as well as the face and most of the neck, and the internal carotid artery, which is distributed within the cranial cavity and the orbit. The common and the internal carotid artery lie in the cleft boundaries. The first is cervical vertebrae and their attached muscle. Second, the pharynx and esophagus, larynx, trachea, and thyroid gland. And third, sternomastoid muscle. The third anatomy of the carotid arteries. The carotid artery ascends along a line from first the sternoclavicular joint along the anterior border of sternocleidomastoid muscle, and second, a point middle to the lobule of the auricle. The left common carotid has also thoracic part. Each common carotid artery is crossed by corresponding omohyoid muscle opposite the cricoid cartilage, the 6 cervical vertebrae, and this is site of compression. The common carotid artery divided usually at the level of upper border of lamina of thyroid cartilage. The pulsation of common and external carotid artery can be felt along the anterior border of sternocleidomastoid muscle. The common carotid artery. We have two common carotid artery, right and left common carotid artery. The right common carotid artery arises from brachiocephalic trunk posterior to the right sternoclavicular joint. where the left common carotid artery branch of arch of aorta ends the thoracic portion before it reaches the neck, posterior to left sternoclavicular joint. The common carotid artery is crossed by the omohyoid at level of the Thyroid Cartilage, C6, and then lie under cover of the anterior border of sternomastoid. They are related to cervical vertebrae. The common carotid artery can be compressed against the transverse process of cervical vertebrae by pressing medially and posteriorly with the thumb. The common carotid usually gives off no net branches in the neck. Each common carotid artery is divided usually at the level of the upper border of the lamina of thyroid cartilage at the level of C4 vertebral arch level. Extend the common carotid artery divided into two arteries, the external carotid artery and internal carotid artery. We start with the external carotid artery. The external carotid artery extends from bifurcation of the common carotid artery and carotid triangle to the retromandibular area. The external carotid artery is crossed by the hypoglossal nerve and passes deep to the posterior belly of the gastric and thyroid muscle. The constrictor of the pharynx lies medially to the external carotid artery. The external carotid artery divides in substance of carotid gland into superficial temporal and maxillary artery. Is the end of the external carotid artery as the carotid gland. One of the structures that pass through carotid gland is the external carotid artery that divides its small branch called it the superficial temporal artery and the large branch called the maxillary artery. The branching of the external carotid artery. There are 8 branches of external carotid artery. The first 4 generally rise in carotid triangle. The first one, the superior thyroid artery, rises in the carotid triangle, then deep to the infrahyoid muscle to enter the apex of corresponding lobe of the thyroid gland, where it is divided into glandular branches. Its general give of superior laryngeal artery, which confines the internal laryngeal nerve. This is the vessels of the larynx, the superior laryngeal artery and superior thyroid artery, that inferior laryngeal artery through cervical trunk, inferior thyroid artery, and comprise the inferior laryngeal nerve. The second branch, lingual artery, may arise in common with the facial artery. Its description in 3 parts is passed on in relation to the hypoglossal muscle. The first part from loop in the carotid triangle and is crossed by the hypoglossal nerve. The second part passes deep to the hypoglossal and lie on middle constrictor. The third part, deep lingual artery, runs along the inferior surface of the tongue. This is 3 parts of lingual artery. Above the lingual artery, the facial artery. Its cervical part ascends the carotid triangle and enter groove on posterior aspect of submandibular gland. It then descends to wind around the inferior border of the mandible at the anterior margin of masseter muscle. The facial artery in its facial part proceeds superior and anterior tortuous course on the face. It supplies the muscle of facial expression to which is variable related. The facial artery ends at the middle angle of the eye by the anastomosing with the branching of ophthalmic artery. The facial vein is posterior and straighter than the facial artery. And the cervical part of facial artery gives of palatine, tonsillar, glandular, submandibular, and mucous muscular branching. This is the branching of facial artery. The facial part gives of the inferior and superior labial artery and nasal branch and end as angular artery. The fourth artery from the posterior surface of the external carotid artery, the occipital artery, arises from posterior aspect of external carotid artery. Its description in 3 parts is based on the relation to the sternocleidomastoid muscle. In the carotid triangle, the hypoglossal nerve hooks around the artery, which ascends deep to lower border of the posterior belly of the gastric muscle. deep to sternocleidomastoid muscle. The arteries occupy a groove medial to the mastoid process. Beyond the sternomastoid, the occipital artery divided into branches of the scalp. The most important branch is in and superficial and deep division of two isthmus with the transverse and deep cervical branch of the Carotid Artery. The descending branch of occipital artery provides the chief collateral circulation after ligation of external carotid or the subclavian artery. The fifth branch, the posterior auricular artery, arises from the posterior aspect of the external carotid artery superior to the digastric muscle. It ends by dividing into auricular and occipital branches. The sixth branch is the ascending pharyngeal artery, arises from medially and ascends to the wall of the pharynx. It supplies the muscle of the pharynx. The seventh and eighth branch, the superficial temporal and maxillary artery, is the end-terminal branch of the external carotid artery. Now, after finishing the external carotid artery and its branch go to the internal carotid artery, we divide it into a cervical part and the cranial part. We discuss the internal carotid artery and cervical part. The internal carotid artery begins at the level of upper border of the lamina of the thyroid cartilage. It enters the skull through the carotid canal of the temporal bone and it ends the middle cranial fossa by dividing into anterior and middle cerebral arteries. The internal carotid artery has no named branches in the neck. Its course may be considered in four parts: cervical, vitreous, cavernous, and cerebral. The internal carotid artery begins in the carotid triangle, which exists by passing deep to the digastric and styloid muscles. The basal is closely related to the cranial nerve 8, 9, 10, and 12, and to sympathetic trunk. The internal carotid artery lies on the transverse process of cervical vertebrae and against the wall of the pharynx. Now, within the bifurcation of the common carotid artery, we have other structure, like the carotid sinus. The carotid sinus is a slit dilatation of the internal carotid artery or jointly of the common and internal carotid artery near the bifurcation. It will contain the receptor sensitive change in the blood pressure. The carotid body lies in the angle of bifurcation of common carotid artery and is sensitive to hypoxemia. إذن يتأثر بالبلاد بريشر ويتأثر بالأكسجين that is in the blood. Thank you for your listening to this lecture.